My name is Brian Bird, and I'm the Program Officer for the Special Projects Fund here at the New York State Health Foundation. The goal of the Special Projects Fund is to be responsive to timely issues that emerge in the healthcare field that fall outside of our two priority areas. We've been able to fund a wide range of programs and organizations across New York State that focus on issues such as the impact of the opioid epidemic on pregnant women, access to oral health services by vulnerable children, making sure that people who are infected with the HIV/AIDS virus have access to quality health care. The Special Project Fund allows the foundation to be responsive to new and emerging issues. It allows us to be innovative and test new approaches, like establishing a healthcare model for resettled refugees in Rochester, New York. We look for projects that can be sustainable beyond the grant, as well as projects that can be replicated. One example is our work with the Cattell Center for Health and Justice in replicating the LEAD model.
LEAD stands for Law Enforcement Assisted Diversion. It's a pre-arrest or pre-booking diversion model wherein police officers, instead of making an arrest for low-level offenses, the officers can use their existing discretionary authority to divert that individual into case management and services.
We've seen over 75 diversions in the past year since it launched. So that's 75 people who would have otherwise gone through the criminal justice system.
When we were pitching that idea to some of the criminal justice funders, they said, this sounds a lot like a health-oriented approach. And when we talked to some of the health-oriented funders, they said, this sounds a lot like a criminal justice-oriented thing. And the Special Projects Fund really allowed us to experiment and try something new, to spend the time that we needed on the ground.
At the time when we were working to bring LEAD to New York State, there was only 2 cities in the country that were actually using the model. Albany became the third. Another way that Special Projects Fund has allowed us to test and replicate innovative models is through our work with Project ECHO. In rural areas of New York, people have to drive hundreds of miles in order to see a medical specialist.
Project ECHO is the extension for community healthcare outcomes. It's a telementoring model to help disseminate subspecialty expertise. I'm a geriatric psychiatry provider. Before we brought ECHO to New York State, I had an 8-month wait list to get in to see me.
Well, since its launch in 2014, Project ECHO is now in 40 counties across New York State. The Special Projects Fund also enables us to respond in a timely way to a rapidly changing landscape. In light of recent federal changes that pose threats to immigrants in the U.S., we work with New York Lawyers for the Public Interest to ensure that detained immigrants still have access to quality healthcare services.
What we saw initially as a human rights crisis became a human rights crisis that was going to explode. The grant that we received from the Special Projects Fund addresses people's healthcare and interaction with the immigration detention system on a continuum. We have an aspect that works to keep people with serious illnesses out of detention. And we are working to improve healthcare for people who are detained.
We fund organizations that are big and small on topics ranging from policy analysis to research to advocacy. If you're interested in applying, all it takes to get started is to submit a brief letter of inquiry. We're looking forward to seeing your ideas.